Thank you and welcome to joining today's 2022 to 2023 influenza season, What's New, Who's Involved and Why. It's presented by Nina Bagta. And before we get started with the program, I just wanted to talk a little bit about who we are. We're IPRO, your QIN-QIO. We are your contracted, federally funded Medicare quality improvement organization. We cover 12 regions of including New York, New Jersey, Ohio, Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, Vermont, Maryland, Delaware, and the District of Columbia. You may hear us called IPRO or HCA, Health Centric Advisor, or Clarence. Thank you for joining us today. We were going to be talking about influenza today, but we don't want to miss the opportunity to talk a little bit about bivalent vaccine and how important it is to continue offering vaccine in your facilities and in your clinical areas. We at IPRO created a dedicated web page with all of the tools and resources that have been created by us. And I'm going to put that link into chat so you can take a look at that. It also provides you a link to email if you have one specific one-to-one technical support that would be helpful. So I'll put that in chat in a minute, but I also want to just introduce Nina Bagtas. She's a 4-year PharmD candidate at Binghamton University. Before pharmacy school, she graduated with her bachelor's degree in biochemistry. She has been working at an independent long-term care pharmacy since 2017. She has completed 4 advanced experience rotations prior to IPRO, which includes CVS, Rite Aid, a Northwell hospital, a medical marijuana dispensary. Nina is set to graduate May 2023 and plans to work either at a community pharmacy or at her current long-term care. Thank you, Nina.
Thank you. Can everyone hear me well?
Yeah.
Okay, perfect. So as mentioned, today I'll be presenting about this year's influenza season and discuss what's new, who's involved, and why. Okay, next slide, please. So the objectives of this presentation are to analyze the previous influenza season, epidemiology and composition, as well as its effects on the 2022-2023 influenza season, to examine the new CDC recommendations for influenza vaccine for people 65 years and older, to compare the different influenza vaccinations recommended for that population in terms of dose, type of vaccine, administration, contraindications, adverse effects, and cost. And lastly, to understand the recommendations of co-administration of the influenza vaccine with COVID-19, pneumococcal, and zoster vaccinations. Next slide, please. So here are just the abbreviations of the influenza vaccines. For the vaccine types, the inactivated influenza vaccine is IIV, and this is indicated for individuals 6 months and older. RIV is recombinant influenza vaccine and is indicated for 18 years or older. And LAIV is live attenuated influenza vaccine eligible to be given to non-pregnant people 2 to 49 years old. The vaccines can either be quadrivalent or trivalent in terms of the number of flu viruses they have protection against. Additionally, there are different inactivated vaccines. So vaccines with a lowercase a means it contains an adjuvant in order to provide a stronger immune response to the vaccination. HD means high dose, so it contains more antigen than the standard dose. And CC means the vaccine is cell culture based. Next slide, please. So now just a quick background on influenza. So it's a single-stranded RNA virus of the orthomyxovirus family. There are 3 types that are known to affect humans, which are influenza A, B, and C. Both A and B are known to cause seasonal epidemics known as the flu season. The subtypes of influenza A are based on surface antigens, hemagglutinin, with 18 different subtypes, and neuraminidase with 11. Influenza B, on the other hand, is classified into lineages. So B Yamagata and B Victoria. So oftentimes the viral surface antigens HA and NA undergo mutations. So these antigenic changes would result in being unrecognizable by the immune system, which is why every year there's a new influenza vaccine. Next slide, please. Okay, so with the human influenza viruses, they are further divided into groups and subgroups. I won't go too in depth with this slide. So the key thing here is that this classification is important in understanding the naming of the virus as well as the contents of the vaccine itself. The components that make up the name are the antigenic type, the host of origin, however, none is given for human origin viruses, and it's followed by the geographical origin, the strain number, and the year of collection and virus subtype. Next slide, please. Now looking at the epidemiology of influenza. So as per the CDC, they estimated that the flu led to 9 million to 41 million illnesses between the years of 2010 and 2020. It also led to hundreds of thousands of hospitalizations and about 12,000 to 52,000 deaths. Overall, CDC estimated that adults 65 years and older account for 70 to 85% of flu-related deaths and 50 to 70% of flu-related hospitalizations each season. Next slide, please. During the 2021-2022 flu season, it has incurred 9 million flu illnesses, 4 million flu medical visits, about over 100,000 flu hospitalizations, and about 5,000 deaths. So that past season was described to as low severity. However, the effect and severity of the virus varied by age group. So higher severity was seen in older adults aged 65 and older, as you can see on the graph on the right, which is that red line. Okay, next slide, please. As mentioned previously, adults aged 65 and older account for a majority of the flu-related events. Specifically for the 2021-2022 season, 83% of deaths and 51% of hospitalizations occurred in this age group. Okay, next slide. Okay, the graph shown here displays the positive influenza tests that have been reported to CDC for October 2021 through October 2022. When compared to prior influenza seasons, the 2021-2022 season was mild and had two waves in which influenza A, H3N2 dominated both waves. So the first peak was in week 51 of 2021, which was around December 20 to 26. The second peak was in week 15 of 2022, which was around April 11 to April 17. So those who were vaccinated during that influenza season reduced their risk of illness by approximately 1/3. Okay, next slide, please. For this season's influenza vaccine, the FDA Vaccines and Related Biological Products Advisory Committee selected the specific virus strains. So the components of both egg-based and cell or recombinant-based influenza vaccines are listed as shown. So for the egg-based influenza vaccines, the recommended AH3N2 component was changed to the A Darwin component, and the recommended B Victoria component was changed to B Austria component. So these were also similar changes to the cell-based or recombinant-based vaccines. However, there were no changes made to the A H1N1 or B Yamagata components on either formulation of the recommended components from the previous flu season. Next slide, please. So as we may all know, COVID-19 infection has similar symptoms as that of an influenza infection. So those symptoms include fever, chills, cough, sore throat, runny or stuffy nose, muscle aches, fatigue, vomiting, and diarrhea. Additional symptoms specific to COVID-19 include shortness of breath and loss of smell and or taste. So due to the overlap, it is very important to test for both viral infections as there are indeed different treatments and guidelines for them. Okay, next slide. So who is the most at risk for complications from an influenza infection? So children younger than 5 years are at risk, especially those younger than 2 years old. Again, older adults age 65 and older are also at risk. Individuals with chronic medical conditions such as asthma, COPD, heart disease, and or diabetes are at risk also. People with a weakened immune system due to diseases or due to some medications and treatments. Pregnant women and postpartum women of up to 2 weeks after delivery, people who live in nursing homes or long-term care facilities are at risk as well. So certain racial or ethnic minority groups have increased risk for flu-related hospitalizations. These include non-Hispanics, non-Hispanic Blacks, Hispanic or Latinos, and American Indian Alaskan natives. Next slide. So according to the Advisory Committee on Immunization Practices, they recommend adults age 65 and older receive a specific influenza vaccine. So I'll be discussing these vaccines in the next few slides. So they could either get the quadrivalent high dose inactivated influenza vaccine, the quadrivalent recombinant influenza vaccine, or the quadrivalent adjuvanted inactivated influenza vaccine. All right, next slide, please. So here, the first vaccine here is the Fluzone high dose quadrivalent. So each pre-filled syringe contains a 0.7 ml dose to be given as an intramuscular injection. Yeah, so this particular vaccine is only approved for use in individuals 65 years and older. So compared to the standard dose, this vaccine has 60 micrograms of hemagglutinin per strain. Okay, next slide, please. All right, so the next vaccine is the Flublok quadrivalent. So each pre-filled syringe has a 0.5 ml dose given intramuscularly. This vaccine is approved for use in people 18 years and older, and it uses a recombinant technology. So it is completely egg-free, which is perfect to use for those with an egg allergy. So Flublok is also said to provide 30% better protection in adults compared to the standard quadrivalent vaccine dose, as it contains 3 times more antigen. Okay, next slide. So the last vaccine here is the Fluad quadrivalent. So each syringe contains a 0.5 ml dose to be given intramuscularly. So this vaccine is only approved to be administered to 65 years and older. It contains an adjuvant called MF59, which is an oil and water emulsion that helps promote a stronger immune response. Okay, next slide. So here is just a side-by-side look comparing the 3 inactivated vaccines that I just discussed. So you guys can feel free to look at the chart later. Okay, next slide. Okay, so there are a couple of contraindications and precautions regarding the flu vaccine. So the vaccine is considered contraindicated in people with a history of severe allergic reaction to any component of the vaccine or to a previous dose of any influenza vaccine other than egg. Some precautions to be aware of are moderate or severe acute illness with or without fever and history of Guillain-Barré syndrome within 6 weeks of receiving the vaccine. So a note is provided here in regards to egg allergies, some flu vaccines are egg-based. So although some individuals have an egg allergy, they may still receive any licensed recommended influenza vaccine appropriate for age and health status. So they just must be given in an inpatient or outpatient medical center supervised by a healthcare provider who can immediately recognize and manage severe allergic reactions. Next slide, please. Okay, so here are some reported adverse drug events that occurred within a week of receiving the vaccines in adults 65 years and older. Looking at Fluzone, majority of them experienced injection site reactions, myalgia, and headache. For those who received Flublok, 30% reported injection site tenderness. Some also experienced headache and fatigue and injection site pain. And patients who received Fluad experienced injection site reactions, headache, and fatigue. So most of the reactions are similar throughout the three vaccines. Some post-marketing experiences include thrombocytopenia, severe allergic reactions, extensive swelling lasting for more than 7 days, GBS or Guillain-Barré syndrome, and facial palsy or Bell's palsy. Okay, next slide. So now a quick look at their costs, which are based on GoodRx. So Fluzone is about $67 to $80 per syringe. Flublok ranges from $74 to $91 per syringe. And then Fluad is about $67 to $78 per syringe. Okay, next slide. So many people are hesitant or concerned if it is appropriate to get both the flu vaccine and COVID-19 vaccines at the same time. So according to CDC, COVID-19 vaccines may be administered without regard to other vaccines, and this includes simultaneous administration of such. So there are studies that compared separate administration with co-administration of both vaccines which reported similar levels of immunogenicity or slightly higher reactogenicity, and no safety concerns were identified. And then there was a retrospective cohort study concluded that there was a more likely chance of about 8 to 11% to experience systemic reactions when co-administration was performed. So the reactions were mostly mild and would subside pretty quickly. Additionally, people have an option of getting both vaccines in the same arm. However, for vaccines that are more likely to cause symptoms, such as the Fluzone high dose or Fluad, they recommend being given on separate arms if possible. That way, it can help reduce side effects in one arm. Next slide, please. Okay, so the other vaccines of interest are the pneumococcal and Shingrix. For the pneumococcal vaccine, those who have never received one should receive either the PCV15 or PCV20 for 65 years and older. If PCV15 is given, then a dose of PPSV23 is followed at least 1 year later. And then as for the shingles vaccine, CDC recommends 2 doses of Shingrix, separated by 2 to 6 months for adults 50 and older. So both the pneumococcal and Shingrix can be given concomitantly at different anatomical sites as the influenza vaccine. Just to take note, studies are still being done regarding co-administration of Shingrix with Fluad and COVID-19 vaccines. Next slide, please. Okay, and lastly, the slide provides a chart summary of the FDA-approved antiviral drug treatments for influenza infection. To briefly go over the drugs, oseltamivir or Tamiflu is given both as treatment and prophylaxis, though its efficacy is not established after 48 hours of symptom onset. Zanamivir or Relenza is also used for treatment and prophylaxis, but it's not recommended for dose with COPD or asthma since it's inhaled formulation. Also, to take note of Relenza, it's not proven to be effective for prophylaxis in nursing home residents. Peramivir or Rapivab is used for early treatment of acute uncomplicated infection and is given as an IV formulation. Baloxavir or Xofluza is also an early treatment of acute uncomplicated infection, and it is weight-based. So when taking Baloxavir, it's just important to counsel patients to avoid co-administration with dairy products and acids or laxatives. So in this chart, I highlighted the agents that have oral formulation as they are commonly used. Okay, next slide. And yep, so that concludes the presentation. And if you guys have any other questions or comments, feel free to.
Thank you, Nina. Please go ahead and put any questions into chat. We're just confirming what vaccine to provide to those over the age of 65. And Terry put in Fluzone as the recommended one. And then I just wanted to confirm that, so if you have an egg allergy, there is a safe vaccine.
Yes. So there are recombinant vaccines that do not contain egg, and they're not like egg-based.
Okay.
So those would be appropriate. They could, if they do have an egg allergy, and the doctors, recommend a vaccine that has egg, they would just have to be given inpatient or in a outpatient setting so that the doctors or whoever the provider is can immediately, just monitor them if there are any reactions after receiving it.
And I really like the slide about the co-administration. I think we hear in multiple settings, we talk to a lot of nursing homes and providers, and we're hearing there are a lot of providers that are still very hesitant to give 2 vaccines at the same time.
I see. Yeah, I haven't really encountered anyone that was too hesitant. Most of the patients that I've encountered, they're like, oh, you can get both of them at the same time. Oh yeah, might as well, since you're already in the clinic or the pharmacy, wherever you are getting the vaccine. Like you can just easily get it done right away.
So we just got a question. We are transitioning from PVR 13 to PVR 20. If I'm understanding correctly, anyone who received either PVR 13 or Pneumovax 23 should receive PVR 20 if it's been at least 1 year.
I believe that's the new pneumococcal vaccine.
Yeah.
So.
I am going to put into chat to help with that, Erin. The CDC has a pneumococcal recommendation app, and it really is wonderful to navigate each one of your patients or residents. You can type in all their information and it will tell you which one is the best choice, because the algorithms can be a little challenging depending on what setting you're in. So I'll put that into chat. And I'm not sure if Terry has some.
I was just looking it up because I was thinking the same thing. That would be a good resource for you to use anytime you're deciding on which pneumococcal vaccine to give to a patient. So I have that link here, Melanie. I'll put it in the chat.
Okay. And what's nice about the PneumoRec Vax app is that you can download it on your mobile device, or you can load it onto the desktops in the nursing station. So it's super easy to have it available to help your staff navigate which thing do you want them to do. So that's a real nice way of handling it. We also had, is the efficacy comparable for all of the 3 recommended vaccines for people over age 65? That was another question.
Oh, the efficacy.
Efficacy.
Yeah, so they're mostly similar efficacy for all those vaccines. So it really just depends on what the clinic or pharmacy has in stock.
Great, thank you.
Yeah, I
So
think
just
Nina, it's true, right, that the dose differs between those three products, but they're all efficacious, correct?
Yes, exactly.
Yes, thank you.
So it's important for those who work in long-term care to understand that the recommendations have been increased to the ACIP recommendations did change for the high dose. And we've kind of talked to people over this last year once the change occurred to see if they were able to get it or not. But right now is the time to consider it with your medical director for next year, because probably you're going to be ordering your vaccine in that April timeframe. So be prepared and already have that conversation that you want to be recommending the high dose. Well, Nina, I don't see any other questions in chat. I thank you very much for joining us today for this great information on influenza
Yes,
vaccine.
thank you as well.